So for my presentation, I chose to do implementation of change in the workplace, and I won't be like showing a PowerPoint or anything. I don't really know how to talk over them or make a panopto or anything, so sorry about that. But the reason I chose this is because I think that many businesses don't know how to properly go over change and how to implement change in an effective way that everyone agrees with. And so I'm just going to discuss some studies that were done that showed good ways to do it and what they recommend. And then I will summarize my results and give recommendations on what I think employers should do. And so I'm going to start off talking about a study that was done in Sweden where they interviewed employees that consisted of a lot of the staff there that included physicians, nurses, and nursing assistants. And they asked them various questions, all concerning about how change affects them and how they go about it. The biggest factor in how people took these changes that were implemented was if they got to be involved making the changes. And some things that the workers said about this was, when changes are gradual and initiated by ourselves, I never see them as a problem. And the biggest changes always come from above, and they are always the ones that are most problematic. And this is all cited from Nelson. And as you can see, all the employees have the same feeling no matter their position in the workplace. They prefer that the employees get to be involved because they feel like they know how to make the rules better because they're the ones that the rules are actually affecting. And when management comes in and just makes rules and doesn't get any feedback from their employees or let them be involved in the process, that's when they can start to run into issues. And another huge thing that goes in implementing change is effectively communicating the change to everyone. If everyone isn't told quickly and efficiently, then they can create many negative attitudes immediately towards the rule change, especially if the employees had no say in the rule change. And some of the things that these Swedish healthcare workers said about this was they almost feel that they have received information and that they have been allowed to express an opinion to be able to influence the changes. And it's all about information to know why we should change. This new apparatus should be introduced, or this system, etc. It's important to get sufficient information that this change will lead to this improvement, or that patient situation is much improved, or you get improvements. And the reason the employees value communication so highly is because, well, they're here, we're all working for the patient, we want to give them the best care possible. And if we're being left in the dark on changes, then they may not be able to do that, which means they're not doing their job correctly, which may hurt their ego or feel like they're not doing what they signed up to do as a healthcare worker. And we all know that there are many lives lost every year that we've talked about in class due to poor communication in healthcare. And a lot of that could be avoided by just improving this communication about things like changes. And for the second study, it was done in the United States, and it has some of the same opinions as the first one, but also has a few different recommendations. Some of the biggest ways they recommend to implement change is having a shared vision, having effective leadership, and dealing with resistors effectively. As you can see, these mirror the previous study, but also include some other things not mentioned, like dealing with resistors. I feel like having a shared vision and effective leadership go hand in hand. Having effective leadership helps all the employees buy into the same thing and not divide the employees, which makes a shared vision. A great way to ensure a vision for a practice is shared is articulating a vision and a strategic direction for the practice encourages input from all the practice decision makers and allows divergent perspectives to be aired and addressed in order to reach a consensus from Gesme. This lines up really well with what the other studies have also said. I think it should be the most important thing on every employer's list when making new changes, and because people need to feel included in order to perform their best at the workplace. And a shared vision can only happen if there's effective leadership and effective communication. According to Gesme, the key to transformational change, or any change, is to have leadership that is able to understand it, support it, explain it, and move the organization to commit it. That is 95% of the success of any change. And what he's saying is that not any, and he's saying that any change, whether it's small or big, starts from the top. And if the people at the top are not able to effectively decide and then communicate those changes to the healthcare workers, then it doesn't matter who works for you. The changes will never go over well. And people always look to their superiors as leaders. And so we need to have the people with the right personality and the right character traits to be in those positions. And another very important step in implementing change is dealing with resistors. You have to approach this very carefully, as they are already in defensive mode because they don't agree with the change. The resistors have a certain mindset that is described as a resistance to change usually comes from fear on one of three levels. What will happen to me in my world? How will my relations to my colleagues change? Or how will our practice and our patients be affected? From Gesme. You must actively listen to them and not point them out publicly. One must have a private conversation with each of them and listen to their concerns and try to convince them that the change will help them on all three of those levels. And if all else fails, you have to eventually get rid of them if they're going to continue to undermine and create a toxic environment in the workplace. So in conclusion, you can see there are many different ways to go about implementing changes. What we cannot do is just change the way things are done and not effectively communicate it, because you will lose the entire staff's positive attitudes and willingness. You must involve the staff and communicate it clearly in an intelligent manner in order to have as much of the staff with a change as possible. You will always have a few people not willing to change either immediately or at all. At that point, you must either talk to them personally or get rid of them entirely. Thank you for listening to my presentation on the implementation of change and why it is so important to do it in a smart and efficient fashion in the healthcare workplace.